Now we move to the assessment part of intake and assessment, and the potential services your loved one can choose from to start or restart their recovery journey. Assessment determines your level of care. It's a medical diagnosis based on the type, frequency, and amount of the substance you've been using and for how long. The assessment process lays out the specific set of services that meet your loved one's needs and the kind of facility where it will be provided, whether through an inpatient or outpatient setting, for example. We'll help you understand the kinds of questions your loved one will be asked and why it's so important for them to answer as openly and honestly as possible, even if they have not shared all the details with you as a family member. And we will go through the key options and decision points for someone who is ready to start or restart their SUD recovery journey. These include both traditional and evolving medication-assisted treatment pathways based on harm reduction practices.
An assessment is part of the determination of the level of care. So the level of care is what type of treatment you actually need. We need certain information to direct the person that's needing treatment into the right process. So everybody's is different, and that would help us to determine what yours should be.
What kinds of questions will my loved one be asked during the assessment?
We need to know the type and the frequency of use because that's going to dictate our approach. There's a difference between someone who's been using a substance for 6 months versus someone who's been doing it for 25 years. There's a lot of behaviors that have been practiced over the course of time. There's a different treatment philosophy or treatment approach with someone who is strictly alcohol versus an opioid user versus a marijuana user or versus a crack cocaine user. We need to know what you were using, how much, how often, because when we talk about frequency, now that dictates in the embeddedness of this substance in the individual.
Both parties have an obligation to act in good faith during the assessment process. The provider should be unbiased and impartial, making sure they listen to your loved one without making judgments and unfairly steering them in one direction or the other.
Staff provide substance use screening and level of care assessments in an impartial manner so that determination results for referrals go to the most appropriate service or program.
An unbiased assessment is the same thing. It determines what type of treatment you need.
At the same time, your loved one must answer questions honestly. That way, they can be matched with the treatment that really fits their current situation.
It is important for a client to be honest during the process so staff can work with them and link them to the most appropriate provider.
You can only draw up your approach or your response based on what I tell you. So that assessment piece is so important. When we're talking about these assessments, 99% of the time, these are self-reports. So imagine this, if you're a clinician and I'm coming to you, you're doing an assessment on me, and I do 20 bags of heroin a day, but I tell you I do 1. That information is it's critical in order for us. We have to have that so that we know when we march forward, we're coming with the best response, the best approach.
When is detox needed, and what is it?
If you're an addict that is using an opiate substance, say heroin or oxycodone or a chemical like that, then you would need a detox before you go into treatment. Detox is very important because it's very hard for a person to walk away from a substance like heroin or alcohol and just be okay without going to detox. It could be very challenging and dangerous. There's a medical facility that does that detox part before you go into the rehab part of it.
What does an inpatient or rehab facility offer?
An inpatient is that the client will be in a facility 24 hours a day, 7 days a week, for maybe 14 to 28 days. Controlled environment is inpatient. And what do you do when you've been using for 20 years? And all of a sudden you're trying to function without a chemical in you. So you separate them from the chemical. And that separation is based on in treatment. And while that separation is taking place, you're also getting educated. It's very hard for a person that's been using for 10 or 15 years to go into detox and turn around and go right back to that same environment that they've been in the majority of their life and not pick up a chemical. There's things you need to do in order to keep the process going like it's supposed to go. The rehab gives you the option that you have a little strength and you know what to do when you go back into the environment. The main objective is to give a client the information they need to continue the journey of staying clean.
What kind of support could my loved one get during outpatient treatment? And why is it recommended for long-term recovery?
The outpatient treatment is a continuation of what you got in the inpatient treatment. The only difference is that you will be going there maybe 3 days a week. So you won't be in a controlled environment. You're able to take care of some of your responsibilities and use the tools that you learned when you were in the rehab, to apply them in your everyday life. And you have to put just as much energy in that as you did in the rehab. Because now you're not in a controlled environment. Now you can make choices. Now you see all the people that you used to see, or you used to run around with, or you used to get high with. And even if you do run into that process, it gives you the ability to change that process.
Whatever path your loved one chooses, recovery plans and supports, including from chosen family like you, are highly recommended to achieve and sustain long-term recovery. We'll talk about those later in the video.